The world is once again reminded that COVID-19 is still with us. In recent weeks, Singapore has reported an increase in COVID-19 cases. This development has caught the attention of health authorities globally. The situation began to show a noticeable change in early May 2025. This rise in infections signals a new wave for the island nation. Neighboring countries are watching the situation very closely. India, with its large population, is particularly attentive. Health officials in India are monitoring reports from Singapore. They are looking at the data to understand the risks. Singapore has managed previous waves of COVID-19 infections effectively. The country has a strong healthcare system. It also has experience in implementing public health measures. This new situation, however, is being watched for its specific characteristics. Health experts want to know if this wave is different. They are studying the virus variants causing the surge. They are also looking at how quickly it is spreading. This information is vital for an effective response. Global health organizations are working with Singapore's authorities. They aim to understand this resurgence fully. Local health bodies in Singapore are leading the response. The goal is to control the spread and protect public health. Let us look at the numbers from Singapore more closely. For the week ending on May 3, 2025, Singapore reported 14,200 new COVID-19 cases. This was a significant jump from the previous week. In the week before, there were 11,100 new cases. This shows a clear upward trend in infections. Such a rapid increase requires careful monitoring. Health services need to be ready for more patients. Hospitalization numbers also provide important information. During the week of April 27th to May 3rd, 2025, daily hospitalizations increased. The average number of people admitted to hospitals each day rose. It went from 102 to 133 patients. However, the number of patients in intensive care units saw a slight decrease. The daily average of ICU patients went down from 3 to 2. Reports indicate that the majority of new COVID-19 cases in Singapore are mild. There have been no reports of unusual severity. Similarly, there has not been a significant rise in mortality associated with this surge. This is a positive sign. It suggests that while the virus is spreading, its impact on individuals might be less severe for most. The primary driver behind the current COVID-19 surge in Singapore is a variant known as JN.1. This variant, along with its sub-lineages, is causing most of the new infections. Specifically, two sub-lineages of JN.1, named LF7 and NB1.8, are prominent. These sub-lineages account for over two-thirds of the sequenced COVID-19 cases in Singapore. Identifying the dominant variant is crucial. It helps scientists understand its behavior and how to combat it effectively. The JN.1 variant is not entirely new to the global health community. It is a sub-lineage of the Omicron BA.2.86 strain, sometimes called Pirola. JN.1 was first identified in August 2023. By December 2023, the World Health Organization classified it as a variant of interest. This classification means that it has genetic changes. These changes are predicted or known to affect virus characteristics. JN.1 has some distinct features that scientists are studying. It possesses over 30 mutations in its genetic code. One notable mutation is found in its spike protein. The spike protein is what the virus uses to enter human cells. Changes here might make the variant more transmissible. The symptoms associated with the JN.1 variant are generally similar to those of earlier Omicron strains. Thankfully, infections are typically mild to moderate. Indian health authorities are fully aware of the COVID-19 surge in Singapore. They are also monitoring similar situations in other countries like Hong Kong. Officials in India have stated that the COVID-19 situation within India is currently under control. This assessment comes from ongoing surveillance. They are closely watching for any signs of increased transmission. This proactive stance is important. It helps in maintaining a low level of infection in the country. India's large population requires constant vigilance. Looking at the current COVID-19 numbers in India, the active caseload remains low. As of May 19, 2025, India reported 257 active COVID-19 cases. This was a slight increase from the 93 active cases reported the previous Friday. While there is an increase, the absolute numbers are very small. This is especially true when considering India's vast population. The nature of the active cases in India is also reassuring. Almost all reported cases are mild. There have been no significant reports of hospitalizations required for these cases. This pattern of mild illness is consistent with current global trends for JN. 1. It suggests that while the virus may be present, it is not causing severe disease widely. Section 5. India's strategic response, the high-level review meeting. In response to the international COVID-19 situation, a review meeting was convened in New Delhi. This important meeting was chaired by the Director General of Health Services. The purpose of the meeting was to assess India's preparedness. It aimed to review the current COVID-19 status in the country. Such meetings are crucial for a coordinated response. They bring together key decision-makers and experts. This ensures that India remains ready for any changes. The meeting saw participation from a wide range of experts. Attendees included specialists from the National Center for Disease Control. Representatives from the Emergency Medical Relief Division were also present. The Disaster Management Cell contributed its expertise. Scientists from the Indian Council of Medical Research participated. Doctors from major central government hospitals shared their on-ground experiences. The consensus reached during this high-level meeting was clear. The experts agreed that the number of COVID-19 cases in India is currently very low. This is especially true when considered relative to India's large population size. The overall situation was deemed to be firmly under control. Following the meeting, the Union Health Ministry reiterated its commitment. The ministry assured the public of its continued vigilance. Section 6. Fortifying defenses. India's public health safeguards. India has a well-established and robust surveillance system. This system is designed to monitor respiratory viral infections, including COVID-19. The Integrated Disease Surveillance Program plays a central role in this. The Indian Council of Medical Research also contributes significantly. These organizations work together to track disease patterns. They collect data from across the country. This comprehensive surveillance is the backbone of India's public health defense. It allows for early detection of any potential outbreaks. As part of these safeguards, hospitals nationwide have received specific instructions. They have been directed to closely monitor cases of influenza-like illness. They are also to watch for severe acute respiratory infection cases. These conditions can sometimes indicate COVID-19 or other respiratory viruses. By tracking ILI and SARI cases, authorities can spot unusual increases. This serves as an early warning system. It allows for prompt investigation and response if needed. The primary purpose of this enhanced surveillance is early detection. By identifying any unusual patterns or increases in respiratory illnesses quickly, health authorities can act fast. This proactive approach minimizes the impact on the population. It also reduces the strain on healthcare facilities. Section 7. Continuous Vigilance Surveillance Mechanisms in India. The Integrated Disease Surveillance Program, IDSP, is key to India's health monitoring. It collects and analyzes disease data nationwide. Health workers report data into the system. This helps detect outbreaks and trends. For COVID-19, IDSP tracks cases and trends, providing a real-time picture for interventions. The Indian Council of Medical Research, ICMR, complements IDSP. ICMR conducts genomic sequencing to identify variants. This helps in early detection of new variants. Section 8. Navigating Forward. Prevention and vaccination in both nations. Comparing COVID-19 situations, India is stable while Singapore sees a surge. Population density, vaccination rates, and health measures vary. Vaccination remains crucial in managing COVID-19. Updated vaccines offer good protection against severe illness. Basic preventive measures are still recommended. Collective actions make a big difference.